First, though, Canada's latest vaccine approval. Health Canada has given the Johnson & Johnson vaccine the green light. It requires only one dose. The other 3 vaccines approved for use in Canada require 2 doses. That means Canadians will now have 4 vaccine options. The federal government ordered 10 million doses of the Johnson & Johnson vaccine with an option to purchase 28 million more, though we don't expect to get any of those doses until at least April. Dr. Supriya Sharma is Health Canada's chief medical advisor. She's in Ottawa. Dr. Sharma, this Janssen vaccine is 1 dose, and we know that that can be a real advantage with hard-to-reach populations like people who are experiencing homelessness. I'm curious, who would you like to see get this particular vaccine?
Well, as you said, we've got now 4 different vaccines, 5 total, but 4 different vaccines. And provinces and territories are really seeing different pandemics, and they've got different demographics. So it's not that as if one vaccine would be perfect for just one population group. You really have to take a look at what's happening and what the best use of all the vaccines that you would have. So for the Janssen vaccine, some people are saying, use it in groups where, there might be a risk that people are not coming back for that second dose, potentially hard to reach areas geographically. But it really is up to the provinces and territories to figure out how this fits into their overall vaccine supply.
I was quite struck this morning with your approach when you were trying to clear up, I guess, some of the questions around vaccine efficacy or some of the discussion around it. I wonder, do you wish that last week when AstraZeneca was coming out, perhaps we had talked about the efficacy question a little bit differently, or that you personally had talked about it a bit differently?
I think it's challenging to take all of this information from all the clinical trials, and something that people have taken hours and hours and hours to go over in great detail. And it's challenging for us, even with one vaccine, that's the same vaccine that's used in different clinical trials that are set up slightly differently. So, I'm not surprised that it is challenging to take all of that complex information and distill it down into, what are really sound bites. But I think, the way that we talk about it, and collectively, this is everybody, we just need to be able to make sure that we're staying true to the information, we're being clear and consistent in the messaging. And as we do that, and as science changes and we make changes to our decisions, I think we need to clearly communicate that as well. It is a complicated situation, but it is in a way wonderfully complicated because we do have, obviously multiple vaccines now that are authorized. They're being, administered in the millions all over the world. We're getting all of that data. So it is going to be complex. We just need to make sure that we're being clear about what we're seeing and that we're, updating people as much as possible.
Still one more vaccine in the approval queue right now, Novavax. What's the timeline on approval for that?
So Novavax will still be at least a few weeks, if not months. We're expecting some manufacturing data to come in, and that's still quite a sizable chunk of information. And we know that they have a large phase 3 clinical trial that's ongoing that's not expected to report out until, at the earliest, maybe early April. So it depends really on the results of the clinical trials and what that shows. But we do know that we're going to be waiting for some information for a few weeks at least.
Okay, so we've talked about sort of the suite of vaccines. I want to focus in a little bit more on who, a question that you were also asked about today, which is younger Canadians. And you noted that Pfizer has done clinical trials that include 16 and 17-year-olds. And so I'm wondering, do you foresee those teenagers, that group, being offered that vaccine in this country anytime soon?
Yeah, in terms of the Pfizer authorization, it included that age group. Mm-hmm. So, it's been authorized for that group. It has been studied in that group. We have a number of other ongoing studies in younger age groups. But, when it's their turn, certainly that would be the preferred vaccine for that 16 and 17 year age group. As we get more information, both about younger age groups for Pfizer and for the other clinical studies that are coming forward, we'll be able to make recommendations for even younger age groups as well.
You made it clear today, though, that it's going to take some time to do those studies on younger age groups. You were talking about, perhaps we could be talking about the end of the calendar year, but that it could be well beyond that. I'm just trying to imagine what that world looks like, where there's an adult population that has largely been vaccinated, but still the younger population that isn't. What do you foresee in terms of restrictions and whatnot if that group, we still don't have the data to vaccinate them yet?
Well, it's the concept of getting as many people vaccinated that are eligible as possible, because the more people that you have that are protected, the fewer cases that you're going to see, and then the less the transmission will be. Mm-hmm. So all of that will create sort of this bubble of protection around children that potentially are not vaccinated. And so that really is kind of the concept of herd immunity, to be able to have people that have that protection that are then in turn protecting the people that aren't yet vaccinated. So, the major thing is getting as many shots in arms as we can, and getting the overall number of cases and the transmission and the viral virus that's circulating down as much as possible. And that's the biggest protection for kids that we can offer them, that we have low viral prevalence in their communities that they're living in.
But do you think that we would still have to accept that, for instance, no big assemblies, no field trips, that there would still be real restrictions on teenagers, for instance, gathering if they couldn't access the vaccines yet?
Yeah, no, I think those measures really depend on what the situation is. And so what we're trying to do with the vaccines, and we know that they're very good at, decreasing the parts of the viral diseases that are threatening, the most, which is hospitalizations, deaths, serious illnesses. As we get those, under control, we can get our arms around the pandemic a bit, right? So it's a bit more controlled, it's managing it. And so when that gets manageable, then you can start lifting the public health measures slowly. And then as you do that, you can, you look at each case on a case-by-case basis in the provinces and territories, and figure out where, you can risk manage those. And again, the most important part of it is that you get those cases down, and then you use, contact tracing, testing, all of those things to be able to spot cases when they come up, and then be able to do all that isolation and the contact tracing. So it's not just sort of a direct, once you get this many people vaccinated, then you can do this activity. You really have to take a look at the whole picture. And I know we always sort of talk about, we sound like we're always worrying and we're always telling people what they can't do. We will be in a position where we can start lifting some of those public health measures. So it really is looking brighter in terms of the future. We just have to be really careful and do that in a stepwise fashion.
That is very encouraging to hear, Dr. Sharma. Just before I let you go, I do want to ask you, we're coming up on 1 year. You have such a unique vantage point on all of this. What do you think is the most important thing that we've learned here in Canada over the course of this pandemic?
I think here's something that I learned. I think it'll be a very personal answer to this question. Like everyone else, the thing that I'm most worried about are my parents, right? They're in an older, higher risk group. I booked my father because he's eligible for his first vaccine. And when that went through, I cried. I think we just don't realize, how much this has touched every aspect of our lives, how much tension we're all carrying, how much impact this has on our lives. So I think one thing that we need to learn is that we need to remember how this feels, because, there have been other situations in the past where we've gone through, nothing quite like this pandemic. But sometimes once it's over, we go back to our usual lives, and we, sometimes forget some of the lessons that we're learning. So it might seem like a strange thing to say, because you don't want to be dwelling in negative feelings, but remember what this feels like, and then use that to make sure that the next time we're facing something, that we're even more prepared for it.
I think that's an excellent thought to end this interview on. Thank you so much for your time today, Dr. Sharma.
And thank you for having me.
Canada added a fourth vaccine to its roster today, the Johnson & Johnson single-dose shot.
The Janssen vaccine is the first single-dose COVID-19 vaccine to be authorized in Canada. The other four require 2 doses. It can be stored and transported at refrigerated temperatures between 2 and 8 degrees Celsius for at least 3 months, giving greater flexibility in how they can be distributed across Canada.
As you heard there, the Johnson & Johnson vaccine requires just 1 shot, and it's easier to transport and store. Dr. Dan Baruch is one of the people who helped develop it. He's also the director of the Center for Virology and Vaccine Research at Beth Israel Deaconess Medical Center, and he is in Boston. Thank you so much for making time for our program today.
Thank you very much. It's good to be here.
Well, the vaccine that you helped develop is now approved for use in Canada. Health Canada, the body tasked with approving this vaccine, concluded that your vaccine has the efficacy rate of 66.9% in preventing moderate COVID-19 illness. It's also 85% effective in preventing severe illness. Just tell us a little bit. There's been a lot of discussion in this country over the course of the last week about efficacy. Help people understand, what does that really mean in terms of what your vaccine is going to do?
Well, the most important thing for a vaccine is to prevent serious illness, hospitalization, and death. And in the large phase 3 trial run by J&J, this vaccine, a single shot of this vaccine, provided 85% protection against severe disease and 100% protection against hospitalization and death. So for those outcomes, the efficacy was outstanding. It had lower efficacy against mild and moderate disease, and we think that's very common amongst vaccines to have lower efficacy against mild and moderate disease than severe disease. So the efficacy was 72% in the United States, and a lower overall because the efficacy against viral variants in Brazil and South Africa was a bit lower. Mm-hmm. But I think the most important thing about the vaccine is high efficacy against the clinical parameters that matter most, namely severe disease, hospitalization, and death, and also preserved relatively good efficacy against the most worrisome viral variants that we've been hearing about, including those from Brazil and South Africa.
I want to ask you about vaccine shopping, Doctor, because this discussion about efficacy has, we see it in other countries, right? You think about Germany or France, for instance, where folks have said, well, I'm not so sure about, let's say, AstraZeneca. I'd like to hold out for Pfizer. You have a bit of a horse in the game. You helped develop Johnson & Johnson. Would you ever suggest that somebody hold out for a particular vaccine?
I wouldn't. I think that all the vaccines that undergo very rigorous review and are shown to be highly safe and highly effective, that's the most important message. And all of these vaccines provide outstanding protection against severe disease. Also, it's really not possible to make comparisons amongst these vaccines for efficacy because they were done at different points in time and different places in different settings. For example, the J&J vaccine was done in the here and now in the setting of the largest global surge during December and January, and also in the presence of more contagious and resistant viral variants. None of those parameters were present for the clinical trials conducted last fall. So it's really very difficult to make any comparative statements among vaccines. The message, I think, is that all of these vaccines are very safe and all of these vaccines are very effective. And the best vaccine is the first vaccine a person can access.
When it comes to the question of variants, is there a world where a booster shot might be needed when it comes to Johnson & Johnson?
Well, I think J&J, as well as all of the other vaccine manufacturers, are exploring the potential of developing revised vaccines that include the B.1.351 variant, the resistant variant from South Africa, or others. Whether these will be used as boosters or as co-formulations for people who have not yet been vaccinated, I think are being explored. And we really don't know that yet. We don't know whether these are going to be needed first, because the current vaccine, at least the J&J vaccine, is highly effective against the variants. But it's good to have these ready to go in case they're needed. And how they will actually be implemented clinically is not yet known.
The last thing I want to ask you about before I let you go, because I know your time is precious, is children. We know that there are some studies being done to look at the efficacy of Johnson & Johnson and other vaccines when it comes to younger populations. But for parents and grandparents and even kids watching at home, Power in Politics, thanks for tuning in, kids. What sort of timeline are we talking about for Johnson & Johnson to be approved for use in children?
Well, pediatric studies are starting. And it's hard to predict an exact timeline because we don't yet know exactly how quickly it will enroll, and the different dose groups will be an age de-escalation. It'll start in older kids and then go younger and younger. What we do know is that the platform, the Ad26 platform, for a different virus, for RSV, has been age de-escalated into children, in fact, down to babies 6 months of age. So we know there is platform experience in children. We will just have to test this particular vaccine in children and then down to younger children and babies.
I mean, the numbers we're hearing are like not necessarily even in this calendar year, for instance, here in Canada. Do you think that's accurate?
My hope is that the vaccine, that we will be able to complete those studies during this calendar year, hopefully by this fall. But it's not yet certain. There's no definitive timeline.
Okay. Thank you so much for taking the time to talk to us about this today. We appreciate it.
Thank you very much. I appreciate it.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.